afternoon, students. Today we are going to learn about the sacrum. Now, the sacrum is the terminal part of the vertebral column. Okay. And the sacrum and coccyx, they are present as the bones of the pelvic cavity. Now, if you see the sacrum, we will see that the sacrum is fuse part of the 5 sacral vertebrae. That means the 5 sacral vertebrae, they fuse to form a single bone in adults. Okay, so this is not a single bone. Sacrum is not a single bone, but it results as the fusion of the 5 different vertebrae to form a single bone, which is now called as the sacrum. Now, sacrum is a triangular vase-shaped bone. See this? This is a triangular. Here it is better seen. This is a triangular vase-shaped bone, and this lies between the 2 hip bones to form the part of the pelvis, articulated. If I show you the articulated pelvis, this is an articulated pelvis, and here is the position posteriorly, okay, in the pelvic articulated pelvis. It is posteriorly placed and forms the posterior wall of the pelvic cavity. It lies between the 2 hip bones. These are the 2 hip bones. Ilium part of the hip bones forms an articulation, that is the sacroiliac articulations, okay, where it joins with that of the 2 hip bones of the two sides. Okay, now this sacrum, beside that, it gives the passage to the spinal nose, okay, as a cauda equina through its vertebral canal. Its main function of the sacrum is to transmit the load, and the load transmission, okay, it receives a lot of load on its surface, okay, that is onto the body of the sacrum, and then this load is transmitted to the 2 hip bones. 2 hip bones, right from sacrum, it goes to the 2 hip bones through the sacroiliac joint, okay, and then it goes to the hip joint to the 2 legs, okay, 2 femora. 2 femora. Okay. Now the sacrum presents various surfaces and various borders. Okay. Now, since I said that the sacrum is a triangular bone, it will show a base. This is the base of the sacrum, and naturally the lower end, the upper end is the base, and the lower end then will be called as a apex of this triangular, okay, base, and so thus there is a base and the apex. Now this base, which is the superior surface of the sacrum, is formed by the first sacral vertebrae. This is the body of the first sacral vertebrae, and these are the 2 lateral masses called as the ala of the sacrum. Now the lower end is tapering here. See, this is the lower end of the sacrum, okay, and as I said that it is called as the apex, and here there is a oval surface, articulating surface, which articulates with another structure called as the coccyx or the coccygeal bones, okay. Now then, beside these 2 ends, it has the 2 surfaces here, okay, rather I will say it has the 3 surfaces. There is a pelvic surface, which is said to be the also as anterior surface, and then there is a posterior or dorsal surface. How you will identify which is the pelvic or anterior surface and which is the dorsal or the posterior surface? Now the pelvic surface is smooth while the dorsal surface is rough. Second difference is that the pelvic surface, which forms the wall of the pelvic cavity, is concave. It is concave forward, while the dorsal surface is the convex backward, okay, it is convex. So these are the 2 pelvic and the dorsal surfaces. Then there are the right and left lateral surface also, okay, and on the right and left lateral surface there is an articular area which is ear shaped, okay, and that's why this articular area which articulates with the ilium of the hip bone is called as the auricular surface, and this auricular surface on either side articulates with the ilium to form the sacroiliac joint. Okay, sacroiliac joint. Now within the sacrum you will see the presence of a canal. See this canal, and this is the sacral canal, which is nothing but the vertebral canal, directly in continuation with that of the lumbar vertebral canal. And through this sacral canal lies the spinal nerves, which comes out through these four pairs of foramina. On pelvic surface there are four pairs of foramina, which are called as the anterior sacral foramina, and here it is, they are also present on dorsal surface, the four pairs of foramina, and these are called as the posterior or dorsal sacral foramina, through which passes the ramus of the spinal nerve. Through the anterior sacral foramina or pelvic sacral foramina will pass the ventral rami, and through the dorsal will pass the dorsal of the spinal nerve. Okay, spinal nerve they will pass here. Now I have told you the enough bony features, so that now what you can do is you can keep it in the anatomical position. Okay, there is no question of side determination, as it is a single bone, midline bone. Okay, so for this you should keep the bone in such a way that this pelvic or concave surface, smooth surface, should face downwards and forward, should face downwards and forward, so that the body of the sacrum here, S1 or sacral first body, it should look upwards and forward. It should look upward. So this is the position of the anatomical position of the sacrum. Don't keep the sacrum vertically like that. This is a wrong anatomy. Always the pelvic surface or anterior surface should face forwards and downward. Okay, so that the body should face upwards. Okay, it should face upwards and forward. Okay, if I will keep this in the articulated, okay, let me do it like this. So I'm not able to show you the correct, okay, I mean to say the whole of this, but this is the position of the pelvis, okay, anatomical position, and in this position this surface, that is the pelvic surface, it faces forwards and downwards. Okay, it faces, and this body of the sacrum here, or the base of the sacrum, it is facing upwards and forward, upwards and the forward. Let us come now to the general features of the sacrum. What are the general features of the sacrum? Let us come first to the base of the sacrum. This is the base, okay, or this is the superior surface of the base, okay, of the sacrum, and the base of the sacrum has a body, okay, this is, and it is, base is formed by the first sacral vertebrae, it is formed. So it will show the features of the typical vertebrae, okay. So it has a body, okay, and on either side of the body there are the expanded massive portion here, which looks like a wing of a bird, and that's why it is called as the ala of the sacrum. Okay, so this is the also sometime called as the lateral mass. Okay, ala of the sacrum or lateral mass, and centrally places the oval shaped body, okay, which is more transversely as compared to the anteroposteriorly. Okay, so this is the body of the sacrum. I'm to say the base of the sacrum. Okay, now from the base of the sacrum you can see there is a presence of this vertebral canal, which is here called as the sacral canal, because it is in the sacrum, so it is called as sacral canal. Through will pass the chorda equina. The spinal cord will terminate at the level of lumbar first, lower border or upper border of L2. Then only the chorda equina covered by the dura and arachnoid matter will come here. Okay, and dura will also end at the level of S2. Okay, S2. Now, there is the presence of this sacral canal is bounded by the pedicles. See, these are the pedicles here, pedicles, and this is the laminae. Okay, lamina, right lamina and the left lamina, as in the any other vertebrae. For example, this is the lumbar vertebrae, and here was the pedicle, here is the lamina, here is the vertebral foramina. Okay, this is the body. In the similar way, here at the base of the sacrum, you see the pedicle here, you see the lamina here. Okay, lamina, and where the two laminae are meeting in a vertebra, where two lamina they meet, there comes out a spinous process. But here the spinous process is present only in the form of a tubercle. So it is a rudimentary spinous process, okay, in the midline. And at the junction of the pedicle and lamina, here are the presence of the two superior articular process which have a concave articular facet, and these articular facets, they are facing posteromedially, similar to the concave articular facet of the lumbar vertebrae. See, this were the concave arti superior, and they, in the same way, here in the sacral first or at the base of the sacrum, this is the position. Okay, this is. Let us now come to the pelvic surface. As I said, the pelvic surface is smooth and concave. Okay, smooth. It presents the four pair of the foramina, and this four pair of foramina, they are at the level of the ridges or lines are there. Okay, there are the ridges or line which indicates the fusion of the different vertebrae. Okay, S1, S2, S3, S4 and S5. So 5 vertebrae are there which have fused to each other. Thus there are the 4 sacral foramina pairs are here. Okay, or pelvic sacral foramina. Okay, and then there are the 4 transverse line or ridges which indicate that this is the site where the 5 sacral vertebrae must have fused. Okay, must have fused. Okay, now let us come to this. This is quite smooth and mostly featureless. Let us come to the posterior or the dorsal surface. As I said that the posterior or dorsal surface is the rough. Okay, it is rough, not smooth that like of the pelvic surface. Okay, and it is convex backward and upward. Okay, now if you will see here, you can see again this superior articular facet which concave facet facing posteromedially. In the midline you will see there is the presence of the 4 tubercle, 1, 2, 3 and 4. These 4 tubercles, they are the spinous process. Okay, rudimentary spinous process. Okay, as I said, this is where the two laminae they meet, it is represented by a tubercle. So this is the spinous process which have fused with each other here. Okay, this part is the lamina lateral to this, and this tubercle which are present in midline is given the name here as the median sacral crest. So hold this thing, see this in the oblique view, this is the median sacral crest is present here. Okay, now just lateral to the median sacral crest there are the 4 pair of the dorsal sacral foramina. Okay, through which will come out the dorsal ramus of the spinal nerves. Okay, dorsal ramus spinal nerve. Now sometime what happens that the laminae of the 5th sometime means almost always. Okay, almost always, here it is partly fused. The laminae of the 5th sacral vertebrae fails to fuse. Okay, And in some of the cases, here the failure of the fusion can go up to the between the laminae of the fourth also. So there is an opening is seen because the laminae and the spinous tubercle have not fused, they are absent. This will form a inverted V shape, the opening called as the sacral hiatus. Opening of what? It is the opening of the sacral canal. See this? This sacral canal opens here near the apex on the dorsal aspect of the sacrum, and this is called as the sacral hiatus. So there may be the different shapes of the sacral hiatus depending on how many laminae have fused to form. Usually it is the fifth laminae of the fifth sacral, but it may go extend upward. It may also extend upward. And another feature which you will see here in the dorsal surface, just I mean to say lateral will be the laminae, and just you will see here the presence of the four dorsal sacral foramina will be seen, but here just lateral to it what you will see will be another ridge-like structure, okay? And this ridge-like structure here, which is not very conspicuous or not very well visible, just like median sacral crest, okay, there is the fusion of the there will be the articular process. See, this is the line of the articular process, and this line just medial to the opening of the dorsal sacral foramina, medial, there is also a ridge is present or crest is, which results due to the fusion of the articular process, and that is called as the intermediate sacral crest. It is called as the intermediate sacral crest. And then foraminas are there, and then lateral to the foramina there is another similar ridge is seen, and that is called as the lateral sacral ridge. It is called as the lateral sacral ridge, okay? So how many crests are the ridges are there? A median sacral crest, intermediate sacral crest, and a lateral sacral crest are there. Why these sacral crests are present here? I have told you that the median sacral crest was because of the fusion of the spinous process. See this? This is the lumbar vertebrae seen from the dorsal aspect, and these are the, so the fusion of the spinous process will give this median sacral crest, and then lateral to it the lamina they have fused here, and then there this articular process will fuse, and articular process will give the intermediate sacral crest, okay, intermediate. Then will come the intervertebral foramina between the two vertebral body, and still lateral to it there will be the fusion of the transverse process of the five sacral vertebrae, which will give you the lateral sacral crest. So median, intermediate and lateral sacral crest, they result because of the fusion of the posterior element of the neural arch, because the vertebrae have fused with each other. So you should now know that median sacral crest is the fusion of the spinous process of the five sacral, except the last one, upper four sacral, usually because sacral hiatus is there, there is lamina and spine have not fused, there is a gap. And intermediate sacral crest is because of the fusion of the facets, okay? This is the articular facets or articular facet joints, and lateral to these sacral foraminas there is another crest, that is the lateral sacral crest, which results due to the fusion of the rudimentary transverse process, right? So this is the dorsal aspect of the sacrum, okay? Let us come to the lateral surface of the sacrum. When we see right or the left lateral surface of the sacrum, anteriorly here we get an auricular articular surface, okay? That's why it is called as the auricular surface, okay, which will articulates with the ilium of the hip bone to form sacroiliac joint, very strong joint, because it transmits the load from the fifth lumbar vertebra to the sacral body, and from sacral body this load will go towards the auricular surface to the hip bone to the hip joint, okay, to the hip joint to the femurs, okay. Now, another thing which you should note on to this lateral surface, just below this auricular surface, now there is a tapering margin, okay, or very thin margin of the sacrum. And on from the pelvic or the dorsal surface, you can also note that is the width is tapering all of a sudden, deep to the this auricular surface, okay, I mean say inferior to this auricular surface. Why it is so? It is so that the upper three, okay, sacral bodies, they are involved in the transmission of load. The fourth and fifth, they are not, because already the load of the body has gone to the hip bone, okay, for the hip joint here. So these becomes vestigial or rudimentary structures, okay, that is the fourth and fifth sacral vertebrae. So because all the weight of the body has, I mean say above, which is coming on to the sacrum, that has gone. Now one thing I forgot to mention, that this is the body which was oval shaped of the sacrum, okay, its anterior margin is prolonged forward, okay, it is projecting, and this is called as the sacral promontory, okay, called as sacral promontory, thus this forward bulge or margin of the sacrum. Okay, so we were on the lateral surface, okay, lateral surface. So this is on lateral surface is auricular surface, and behind this lateral surface, this area, it is called as the tuberosity, okay. Okay, this is for the sacral tuberosity, rough area. See this large rough area behind the auricular surface or posterior to it, and this will give attachment to the sacroiliac ligament, and very strong. So it is intraosseous sacroiliac ligament is attached into the sacral tuberosity. So auricular surface and sacral tuberosity, these are the two features of the lateral surface. So we have covered the apex, we have covered the, I mean to say, apex and the base, okay, and the two lateral surfaces, pelvic surfaces and dorsal surfaces. Here, this is the general features of the sacrum, and quickly I will show you some of the important particular feature, that means muscular attachment of the ligaments, and that of the relations of the nerves and vessels, just from the diagram, okay, just from the diagram. Let us see this book. This is the book on human osteology, written by me, published by the PP, and I acknowledge their, I mean to say, use of this book to the publishers. Okay. Now, this what you see here into the particular feature is that the muscle, first see, this is the piriformis muscle, which on right side, this is the pelvic surface of sacrum. This surface, pelvic surface of the sacrum is here, and here this gives origin to piriformis muscle. This also gives origin here from a small part of the iliacus muscle, and there is a muscle which will show the insertion onto the lower lateral margin of the pelvic surface, as well as onto the coccyx. This small bone attached to the S5 is the coccyx, which has the four small pieces, rudimentary, I mean say vertebra. Four pieces of this vertebra are there. So these are the muscles which can see on the pelvic, can be seen on pelvic surface. Then on the dorsal surface, this muscle which takes origin is a strong origin of the gluteus maximus from the lateral margin below the auricular surface. It is the lateral margin of the lower part of the sacrum, and that of the posterolateral aspect of the coccyx muscle, I mean say vertebrae. Then there is another strong origin from either side, right and left. That is, the muscle is called as the multifidus and the erectory spinae, which are the muscles of the beak, which will run upward. Okay, so these are the important muscles which are attached to that of the sacrum. Let us come to the ligaments. And ligaments which are important, I have already told you that there is the ligament interosseous ligament, this green color in the sacral tuberosity. Interosseous ligament of the sacroiliac joint, just behind the auricular surface in the lateral surface, and then the sacrotuberous, lower part of the sacrum, okay, and this gives origin to a very strong ligament, what is called as the sacrotuberous ligament. And then another ligament, which is the sacrospinous ligament, coming from the ischial spine, going to the lower lateral margin of the sacrum and the lateral margin of the coccyx. Okay, these are. And another ligament here is the iliolumbar ligament, which is there. Okay, now after the muscles and ligaments, let us see the attachment, relation of the vessels and now this artery which lies almost to the in the midline, this is called as the median sacral artery. Okay, and another artery which is on the lateral to the foramina, it is called as the lateral sacral artery. So median sacral and lateral sacral artery, and coming out through the four pair of foraminas is the ventral rami of the spinal nerve, that is from the S1, S2, S3, S4, and this is the S5, which comes out through the sacral hiatus, and then it comes just above the coccyx. Okay, coccyx. Then medially, okay, close to the foramina lies the sympathetic chain. Okay, and this forms a ganglion here in front of the coccyx called as ganglion impar. Okay, and these are the ganglions of the sympathetic chain. On to the lateral ala of the sacrum lies, here is the lumbosacral trunk most medially, then there is an artery, that is the iliolumbar artery, and then there is a laterally is the obturator nerve. It is the obturator nerve. Then on to the posterior aspect, you will see that these are the four pairs of the foramina, through which are coming out the dorsal rami of the S1, S2, S3 and S4 sacral nerve, and then from sacral height it is the S5 which is coming out. Okay, so these are the dorsal rami. Okay, these are the dorsal rami. So these are the particular features of the sacrum: muscular attachment, origin and insertion, ligamentous attachment, and the relation of the nerves and the blood vessel. Now, as far as the applied anatomy of the sacrum is concerned, applied anatomy of the sacrum is in relation to the fusion of the neighboring vertebrae. That means L5 sometime can fuse with the sacrum. Okay, that is called as sacralization of the lumbar vertebrae. That means L5 becomes the part of the sacrum, partly or completely, and then the sacrum, if it is completely, sacrum will have the 6 pieces instead of the 5. Similarly, the S1 part or the S1 vertebra may become detached from the rest of the sacrum or will not fuse, and it will form a separate bone. Okay, then it may partly fuse or it may fuse completely, and then it is called as the lumbarization of the sacrum. That means the first sacral vertebrae becomes a lumbar vertebrae type of the vertebrae. Okay, so this kind of the structure can take place. Now, since this the sacral canal contains the nerves, okay, cauda equina nerves, which at the level of S2, the dura mater and arachnoid matter will terminate, and then only the nerves will come out, covered by the dura mater in the sacral canal. And through this hiatus, that is the sacral hiatus posterior to the body of the fifth are here. Okay, this is the cornua. Okay, the lateral margin of this sacral hiatus, they are called as the cornua. Okay, and they represent the articular process. So this is the articular process of the fifth lumbar vertebrae. Okay, now with this sacral hiatus and this cornua can be felt, okay, by deep pressure, and then the anesthetist can put the needle of here to inject the anesthetic agent, okay, drug, so that the drug will affect those nerves, sacral nerves, which are coming ventral rami or the from ventral rami or the dorsal rami. They will get anesthetized for some time. Okay, so this is called as the sacral anesthesia or sacral canal anesthesia. Okay, and this kind of the anesthesia which is through the sacral hiatus, okay, this is used for the surgery in the perineal part, okay, or also in the to relieve the pain in the difficult labor, okay, during the childbirth. Okay, during the childbirth. Okay, this completes the bony and particular features of the sacrum. Thank you very much for watching this video on sacrum.